Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the knee. It is the patella grind test, or the Osmond-Clarke test, or Clarke's test, or Clarke's sign, whatever that you want to call it. So this test is looking at diagnosing disorders in the anterior knee. It's commonly associated with diagnosis things like patellofemoral disorder, chondromalacia of the patella, or like patellofemoral arthritis. So I wanted to find out, why is it called Clarke's test? Who was Clarke? And I will tell you, it's hard. You can't find like the original article or the reference or where it came from. But I will say I speculate that this is who it came from, because this is what I found. But a physician in the British Royal Air Force, he was an Air Commodore, but Dr. Henry Oswald Clarke. Now, from what I found, he was somebody who worked a lot with soldiers, and it looks like it was possibly around World War II, but he just kind of talks a lot about these injuries. I couldn't find exactly, like I said, that he is credited with this test, but I believe that's where the name comes from. But anyway, let's get in on how to do it. To perform this test, you have the person lying on their back. So you take one hand and you want to take this web space right here and put it on the superior area of the patella. Then what you're going to do is you're going to ask them, I want you to contract your quad, squeeze that muscle right here as hard as you can, and you just apply a compressive force to it and you hold it. And if they cannot hold it for more than 2 seconds, without it producing pain, or they're just like, it hurts, stop, it's considered a positive. But that is how you do Clarke's test. In getting into the research for this test, it doesn't look very good, just to tell you. So one study in 2005 found that in looking at these healthy people with anterior knee pain, they found that the false positive rate was 42.3%, very, very high for a test. They did do some looking at like the sensitivity specificity of issues in 2008 and found that the sensitivity was 39%, specificity is 67%, positive predictive value of 25%, and negative predictive value of 80%. So they said a lot of this, it's more of a test, like if it's negative, that it's kind of like, oh, okay, this isn't painful, this most likely not something going on. But they said that this test has such a high false positive rate because you're doing that compression into the patella, into that joint space. So they said it's not really like looking at diagnosing something very well. It just kind of points out more that there's irritation in that anterior knee in the patella area. Now, I do want to talk about one research study I found was pretty interesting. They had individuals with a patellofemoral pain syndrome going on, and they did Clarke's test with them. And they want to see the brain activity and how it was processing the pain. And when they did this, they found that the individuals dealing with this chronic pain, they had differences in their pain perception, their emotional processing, sensory motor integration, and the threat appraisal. So they were saying, these people have a higher level of fear of movement, which they believe cause changes to the central nervous system, altered pain modulation, and cognitive emotional factors. So very, very, very interesting to believe it. So they said, in getting in with people who have patellofemoral symptoms, like you need to address a lot of things like movement fear, pain beliefs, just greater exposure to activities, and nervous system sensitization, along with just like strength training and changing up biomechanics. So it was a pretty interesting paper kind of overall of just using this test of just like how people process pain, many of the things that we talk about anyway. But anyway, that's Clarke's test, or the patella grind test. What do you think? Do you use it? Do you remember it from PT school? Like, yeah, that thing was goofy back then and it's still goofy now. Anyway, let us know down in the comments below. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.